Good morning, everyone. Thank you for joining us. I'm Dr. Velasquez, the health officer for Spokane County, and today I'm joined by registered nurse and MRC / Medical Reserve Corps volunteer, Joseph Joe Granelli, who has done a lot of community activities as part of the Medical Reserve Corps. And we're going to talk a little bit about today the process that we're following to train and help with education on Naloxone / Narcan because of the significant number of overdoses that we have in the community. So I'm going to say welcome, Joe. Thank you for being here today. So the first thing everybody always wants to know is how long have you been a volunteer and why did you volunteer to join the Medical Reserve Corps?
Well, first of all, thank you very much for having me here this morning. I became interested in looking into things to do after retirement from my position with Washington State Department of Health, where I was a healthcare investigator.
Oh.
And as I approached retirement, I had run across an office in King County, which was the office for the Medical Reserve Corps. Well, that kind of piqued my interest, and I started looking into that particular subject matter and found that Spokane County also had an MRC program. So in 2018, I ended up applying to the program. At that time, things were moving a little bit slow through the application process. But in spring of 2019, I got my notification that my background had cleared, and I became a member of the MRC. Took about a year to go ahead and take various supporting courses and training, getting ready for the position, and really got into the swing of things with the onset of the COVID crisis. Once that occurred, I found myself involved in several events where I assisted along with a number of great volunteers in giving the COVID vaccination at various sites. And since then, I've also been involved in sites offering immunizations to children for school, and became interested in the Narcan issue as a result of the opioid crisis that we're all aware of occurring in our society. And an opportunity arose in which I could get in on the ground floor with that program with the MRC, and was fortunate enough to be picked for that, and have since then participated in providing presentations on Narcan use and that subject matter for the last couple of years, and have done a number of the presentations in a variety of organizations, everything from family service agencies to church groups, the Sheriff's Department Search and Rescue program, and the Sheriff's Department Chaplaincy program, to just name a few. But there have been a number, and it's been very rewarding. I've worked with a great group of people, Les Radner and Tyler Hinthorn in that particular program, and they've been great to work with. Plus, we have others that have since come in too.
Well, thank you. That's I'm glad you mentioned all of that because a couple of the things I want to highlight. One is our Medical Reserve Corps, and if you don't know what the MRC is, I will ask you to Google that. It goes back to post 9/11. And if you look at the history of the Reserve Corps around the country and in our community, they have been active in pretty much every major disaster, every hurricane name since then until now, as well as wildfires, H1N1, and COVID most recently, which is what a lot of people remember.
Yes.
And as you pointed out, now we've pivoted that knowledge and resources to help address kind of like the opioid crisis with training and education on the use of Naloxone / Narcan. A lot of people know it as Narcan, but it is Naloxone is the chemical name. So one of the things that everybody says, if I get trained, how difficult is it going to be? Is it simple? Is it difficult? Can anybody do it? Do you require special training, a license? Tell us a little bit about that.
No license is required to receive training involving the administration of Narcan, Naloxone. And what we do is we put on a presentation that usually runs about 30 minutes to 40 minutes. And in that presentation, we talk a little bit about the history of Narcan. We talk about where it comes from. We talk about what Narcan can do in reversing opioid overdoses and what Narcan can't do. It can't go ahead and deal with some of the new designer drugs that we're seeing on the street in the way of such as xylazine and nitazines, other drugs that are evolving and resulting in overdoses in the community. So we also talk about the signs and symptoms of overdose. We always stress that the very first step when you come into a situation where there is a possible overdose is to always call 911 first, start the EMS system, and make sure you have help coming along the way. We talk about the administration of the applicator, and we talk about the contents of the Naloxone kit. At the end of it, each person in situations where there's a nonprofit, we try to provide an individual kit to each person.
Wonderful.
So that they're able to go ahead, take that home, carry it with them, and use it safely and appropriately. There are some things that people need to be aware of when they utilize naloxone or they have it with them. One is there's limitations on the storage temperatures that it can tolerate. There's a 3-year limitation on shelf life for the medication, and we cover those things pretty closely. By the time a person walks out of our training, they know about the drug, they know how to use the drug, they are made aware that there are laws that have been passed in our state which protect those who are acting as good Samaritans, trying to help reverse an overdose and save a life. And they're also given information as to how to obtain additional naloxone once they go ahead and reach a point where the drug has either expired or they have used it in the field, hopefully successfully.
Wonderful. And I see you have some samples here.
Yes, I do. Yes, I do. I have one box here that's an expired box, and what I'd like to do is just show the contents. So what's in each of these boxes? It comes with 2 applicators, and they're packaged individually. Each one of these contains only 1 individual dose, and once the first dose is administered, if the patient does not respond positively within 3 minutes, a second dose is administered. And hopefully by the time we get that on board, the cavalry will be there to go ahead and assist with taking over further care. So the applicator itself is very small, very easy to use. It's a simple process of going ahead and taking the applicator, inserting it into a nostril. There's an applicator plunger here, which here is in red. You just go ahead and push down quickly and try to keep the patient's head up a little tilted, so that the contents are directed directly into the membranes in the nose. And from there, we monitor the patient, provide support, assess for pulse and breathing and respiration. And if there's a need for any type of cardiopulmonary assistance, we're recommending that people go out and obtain training in that particular area from the American Heart Association or the American Red Cross, and to utilize that training as appropriate in assisting with the recovery of a patient experiencing an overdose.
Thank you. That is wonderful. And a couple of things that you mentioned I think are important. And one of them happens to be a common misconception,
Yes.
which is, well, if I help someone, I may be at risk for a lawsuit or something. And you highlighted that any citizen that assists someone in distress is covered under the Good Samaritan laws.
Yes.
The second thing is if the person doesn't have an overdose, Narcan naloxone is not going to harm them
That's correct.
because it only activates when the opioid is in the system.
That is
And then the
correct.
third issue that people usually worry about is how simple or difficult is it going to be to use. And you just demonstrate, you just up the nose like this, and many of us have used similar medications for like allergies and
Absolutely.
all kinds of other things. So hopefully lots of people have seen it. I want to mention that we have partnered with City of Spokane and have the distribution of naloxone/Narcan in all of the libraries, which is something that we've done. I know the Medical Reserve Corps has deployed and helped lots of community partners. So I mentioned misconceptions and talked about a couple of things. Anything else that people should be aware that they may not be clear about?
Well, there's been some misconceptions about whether or not a person who goes ahead and obtains naloxone in an effort to go ahead and possibly deal with an opioid overdose, there's a stigma that's become attached to it in some circles, in which the very idea that if one obtains naloxone, that it's in a way giving tacit approval to the misuse of opioids. And that's not true. The naloxone option, having that in your toolbox of things to do in your first aid kit, it gives you a way to be able to effectively address a person who is struggling for whatever reason in their lives, and at that moment struggling to go ahead and maintain their very lives. And each person in our country that we come into contact has value and worth and are deserving of an opportunity to go ahead and recover and to go ahead and go on with their lives. People love them, and people have this tool available to address a very serious problem very quickly and very efficiently, and often with a very positive result.
Wonderful. And if someone listening today says, you know what, I would like to get some training and learn how to use it, where should they go? What do they need to do?
Well, here in the Medical Reserve Corps, we have our coordinator, Jennifer Wallace, is a contact point here in the Spokane Health Department, who can go ahead and set up training sessions with our volunteers. And again, we're able to provide free Narcan in many circumstances as part of that training. And she would be who I would direct individuals to contact to move forward on such an effort.
Wonderful. And as we were speaking, I know the team has put up on the screen the number to contact us and the website with the email address. So if you're not sure, you go to srg.org and click, and you will find it. You will find us there, and certainly we'll be happy to help you. So, Joe, I do appreciate you coming today, and just a couple of things. I've heard lots of people that have this in their first aid kit.
Yes.
Many of us have a first aid kit in the car, at home, etc. A second thing you mentioned, this doesn't mean that you may be using substances of any kind. It only means that you, as a concerned member of the community, if you could help someone, you will do that the same way that you will help if somebody's bleeding, somebody having chest pain,
Absolutely.
if somebody passes out because of blood pressure or whatever. We typically go and try to help. This is just one tool.
Absolutely. It's the same level as carrying around a tourniquet in your pocket. For a person that wants to go ahead and deal with an emerging life-threatening emergency, this is the way to go ahead and at least start that process, along with the phone call to 911.
Wonderful. And remember, if you do see someone in distress that is unresponsive, always call 911 and then proceed And remember, if the person is not actively overdosing, this is not going to harm them. And no, you as an individual will have no liability for trying.
Absolutely, you're
Good
protected.
news, in Spokane, we do know that our first responders are really, really good at responding very quickly.
They are.
So when you mention, by the time you're thinking about that second one, quote unquote, the cavalry is there, typically our first responders and emergency personnel to deploy very, very quickly.
Yeah.
So I'm going to say thank you again to Joe. Last night we had the pleasure of doing a recognition event for Medical Reserve Corps at the Spokane Regional Health District for Spokane County, because they have really helped on a lot of things and continue to find ways of being helpful to the community. If you are thinking about retirement, or if you're thinking about something that to do in addition to your activities just to help members of the community, you can follow Joe's example and contact us. You will go through the training, you will get all the appropriate tools that you need to do your specific job, and you will help someone in the community. And this can save a life. With that, I'm going to say thank you again. Thank you for joining us today. Have a great day, and we will see you again next week. Thank you.
Thank
Joe.
you. Thank you.